So we'll get started. Welcome everybody, and thank you so much for joining us for our Reimagining Healthcare for Young People webinar. My name is Anya, and I'm a young healthcare consumer with a complex disability that has traveled right through the health system from birth. I'm also the founder of Champion Health Agency and a member of the youth working group that has put the event tonight together. So we're incredibly excited because we've had over 230 registrations from young people, health staff, health organisations, consumers and carers from across the state who'll be joining us tonight. But before we go any further, I'd really like to hand over to Keely to do an acknowledgement of country.
Hi everyone, thanks Anya. Today I acknowledge the Yugara and Turrbal people as the traditional owners and their custodianship of the land on which I come from today. I extend this to the traditional owners on the lands from which we all join this webinar from. I pay our respects to ancestors and their descendants who continue cultural and spiritual connections to country. I recognise their valuable contributions to Australian and global society, and I also want to acknowledge any Indigenous people here with us today. Thank you for joining us.
Thank you so much, Keely. So the Reimagining Healthcare for Young People webinar tonight is co-hosted by Queensland Health's Queensland Child and Youth Clinical Network and Health Consumers Queensland. If you'd like to know more about the hosts, please click the link in the chat. Before we start, we do have quite a bit of housekeeping to get through to make sure that the meeting is kept on track. So for this afternoon's youth webinar, only the panelists can be seen, not the audience members. Only panelists can speak. So audience members, please participate in conversation with each other through the chat, or if you're wanting to submit any questions, there's a Q&A icon in the bottom bar with two speech bubbles, and that's how you can actually submit questions to the audience. So, sorry, for the panelists, for questions submitted through the Q&A, our panel will only be able to get through just a few questions this evening, as we've had such an overwhelming amount of questions in the registration process. Please do not let that discourage you from submitting questions tonight, as we really want to hear from you in the audience, and we'll make sure that we can actually collate all those questions, prepare answers, and release them in a position paper after the event. So, as you know, in the chat bottom bar, please use it to provide commentary. We love a good compliment, so make sure that you put it in there. But we also ask that you kindly do not raise your hand during the meeting, but use the chat option to contribute. We do have closed captions in this event. So if you can click that CC icon in the bottom bar, that will enable captions. But if you have any issues with any tech throughout the night, we do have the wonderful Brianna and Chelsea online, who are our excellent tech support. So the purpose of tonight is really to hear from the young people who have created change in healthcare, and how they've experienced healthcare and what actually can be done to make it better. Tonight, you'll hear from a diverse panel of young people with different health conditions, different experiences coming from different places around Queensland. But we're also joined by the wonderful Tanya and Henry, who will be providing a perspective from the health system. So tonight, we're really hoping that our panel can explore what actually matters to young people, what does great care look like for young people, and how do we get there? What barriers actually need to be removed? So we hope to do this by answering the questions from participants and also any that come through live tonight. A quick note on respect before we get started, as it's really important that this is a safe space for everyone to share their lived experience and share their perspectives. However, not everyone is going to have the same perspective, and we just want to make sure that we're respectful of everybody's voices. If there are any issues with disrespect, you will be removed from the webinar. Please make sure that you suspend any judgment and allow others to be unpolished in their speaking. If you're unsure of the meaning of what anybody has said, then ask for clarification in the Q&A section. Please also remember to consider the whole audience and not just the panelists represented on your screen. All participants also need to be reminded that Queensland Health Language Preference Guidelines, where Aboriginal and Torres Strait Islander is to be used when collectively referring to Indigenous Australians. One last note before we get started, we wanted to talk about the language of adolescent and young adult, and also young health consumers. So there are many definitions on who young people are and who AYAs are, but it basically can range from 13 to 25, 13 to 18, 16 to 25, or 16 to 30, depending on the context and the setting that they're receiving healthcare in. So finally, it's enough of listening to my voice just for a little bit, and I'd love to introduce each of these panelists, or actually have them introduce themselves. We've got Ellie, Jordan, Lachlan, Megan, Rihanna, Keely, Henry, and Tanya. So to kick off tonight, I'd really like to ask all of the panelists if they could introduce themselves, but also share, what is your vision for the future care of young people? I'd love to kick off with Keely on this question, please.
Hi, everyone. Someone's decided to start mowing their lawn just then, so I apologize. But my name is obviously Keely. I have family connections to the Yugara people from southeast Queensland, but I grew up on Inangai land in central West Queensland. I come today as both a young consumer and a future practitioner, currently studying a Master of Public Health, Indigenous Health, and will commence a Doctor of Medicine next year.
Great, thank you so much, Keely. Ellie, would you like to share a bit about yourself and the vision?
Here we go. Thanks for the opportunity, Anya. My name's Ellie. I'm 27 years old. I live with a diagnosis of quadriplegic cerebral palsy, and I am from Caboolture, which is north of Brisbane. I would say, in terms of my vision for healthcare, not just for young people, but healthcare in general, would just be to slow down, be more connected by disconnecting. You know, I think in life in general, we're all so busy, we're all so connected, but the value of having a face-to-face conversation or an interaction can't be underestimated. You know, so we really need to stop and listen, and actually use our listening ears rather than, you know, sitting behind a computer screen like we are tonight.
Thank you so much, Ellie. I couldn't agree more. There's nothing really that can replace that human connection. The next person I'd love to hear from is Megan. What's your vision?
Hi guys, thanks for having me. So my name's Megan. I'm a healthcare consumer and also a medical recruiter. I live with multiple chronic illnesses and dynamic disabilities, and they create a fluctuating impact on my daily life. I've struggled with that since I was around 11, 12 years old, and I'm turning 27 this year. So quite a journey. Been through transitional care from pediatric to adolescence, moved through the hospital system, and I've struggled with accessibility to support throughout, both financially and emotionally. Reimagining healthcare to me is about creating more opportunities for better communication and understanding across various parties, regardless of age, gender, orientation, ethnicity, etc. I'm all about breaking down barriers to make healthcare more accessible and less confronting for all, but with a particular focus, especially on young people.
Perfect. Thank you so much for that, Megan. Next, I'll go to Rihanna. What's your vision?
Thank you for having me. So a bit of my background is I've spent the past few years of my adolescence overcoming and working through chronic disease, being cancer, and all the medical complications that come with that. So I feel a reimagined health system for young people is one where any adolescent or young adult consumer feels heard, respected, and can rely on to receive compassionate and holistic care, no matter who they are.
Thank you so much, Rihanna. That was put so beautifully. Jordan, would you like to share a bit about yourself and your vision?
Hi, everybody. I've got some tough responses to follow, and I'm so excited to be here with such a wonderful group of young people. So my name's Jordan. I've had personal experience with a number of conditions, but my most significant experiences were accessing mental health services as a young person. So that's where the majority of my advocacy sits. So when I think about a reimagined health system, I really think about, you know, learning to value and emphasize and structurally recognize the value and importance of lived experience, and recognizing the input and the truth that people have about their own lives and the way that that can really influence a more cooperative healthcare system for them.
Thank you so much, Jordan. I think the power of lived experience can never be underestimated. Lachlan, would you like to share a little bit about yourself and what a reimagined healthcare system looks like for you?
Absolutely. My name is Lachlan. I grew up living with two younger brothers that had a myriad of complicating medical conditions. They grew up in and out of hospitals across America and Australia. And I grew up as their older brother by their side, often in those hospital and clinical environments. So I, at a young age, when their health started to stabilize, I started to become their advocate alongside my mum, advocating for more patient and family-centered care in hospitals around the world and all throughout Queensland. And I've been doing this work for a while now in a number of consumer-based roles. And I've also made a bit of a career working in the healthcare system. I recently was working at Health Issues Centre down in Victoria as a policy officer, and I was focusing on youth issues, trying to bring affordability, approachability, and accessibility to healthcare, and that's really important to me. In an ideal world, I would love to see in reimagining our healthcare system in a positive way. I would really love to see, we have this incredible medicine in Queensland. We have great clinical systems in place, but I would really love to see patient and family-centered care brought to the forefront, because it's important to realize and understand the potential of that complementing clinical care. Patient and family-centered care is so important because it's all about the experience outside of medicine and treatment that patients and families are receiving. And I think that's really important to shed a light on through these sorts of discussions.
Absolutely, Lachlan. Thank you so much for that. I couldn't agree more. And for anybody wanting to follow Lachlan's wonderful career, he's really progressing so beautifully and is joining us from London, which is very exciting. Now that we've heard from our young people perspectives, I'd really like to hear from Henry. What does a reimagined healthcare system look like for you?
Hi, everybody. Hey, thanks so much for having me on the panel. My name's Dr. Henry Goldstein. I'm a general pediatrician, and I'm also the first adolescent medicine and young adult medicine trainee in Queensland. I've got about 2 months to go until I'm a specialist, which is really exciting to be working and sort of living and breathing in this space. I spent a bit of time writing at about 4 or 5 paragraphs about how to reimagine the healthcare system, and then ended up condensing it into one simple phrase, which is a reimagined healthcare system is about developmentally appropriate healthcare. That's it.
That's perfect. Thank you so much, Henry. And I think we're very, very lucky to have you looking after so many young people here. Last but definitely not least, I'd love to hear from Tanya. What's your vision?
Hey, Anya. Hello, everyone. Such a pleasure to be here on a panel with such esteemed young people and, of course, Henry. I work on the executive at the Children's Hospital and Health Service as the Executive Director of Allied Health, and I'm responsible for some work that we continue to do and progress around person-centered care. In terms of a vision for healthcare into the future, I, like Henry, had gosh, a good half a page to say, but I've drilled it down to actually a phrase. And really, for me, it's about trying to imagine and implement the kindest possible healthcare system that we can, and one that's really much more integrated. And when I mean kindness, I mean one that's as easy to navigate for young people as possible.
Perfect. Thank you so much, Tanya, and thank you to everyone who's joining us as an attendee and as a panelist. I think we're going to have a wonderful discussion this evening. So our first question is really around how young people can get involved as health consumers and be part of the change. So my first question is, what opened the door for you to get involved in shaping the healthcare system for young people? Was it an invitation from a healthcare provider, or did you knock on or have to actually knock down doors? Person I'd love to hear from first on this is Jordan.
Thanks, Anya. Yes, so I was in the very interesting position of being approached by a couple of members of my treating team, which was very effective and quite flattering actually at the time. I think they'd picked up in a couple of my sessions that I had some feedback to pass on. And so I was engaged in a co-design process that way. And I was so excited by having my input feeling like it was really heard and valued, and that something was going to happen from it, that I just kept looking into every possible thing I could find. And so I've been doing that for about the past 4 years now. And as effective as that was for me, I would also like to say it's a very tricky kind of approach. I wouldn't say it's the most effective way or the most appropriate way always to engage young people. It's really about where that young person is at the time, whether or not they're ready to start sharing those experiences in that way, and how you can appropriately identify the right channels really to get in touch with them about it. But definitely in my case, it was probably the best way to reach out to me and to know that the things that I'd been saying, in communication with my own health treating team had really been understood as having the potential to be valuable at a systems level was incredibly valuable for me.
Thank you so much for that, Jordan. And I think that really speaks to how, we partner on the individual level and then we partner on higher levels as well. Megan, how did you get involved?
So I openly advocated across a lot of my social channels about my journey and my struggles, and that sparked the attention of a few different stakeholders who approached me and developed working relationships with me. One such stakeholder may be the host of this meeting. So Anya, for those of you who don't know, she runs a fantastic health advocacy business called Champion Health Agency. This opportunity came through to me via Anya, and without being approached directly, I wouldn't have even known where to have gotten involved in this type of opportunity. And I'm very fortunate to have that there, and I'm openly ready to jump in and sort of take on anything that comes my way in this space because I'm so passionate about it. But I think it is one of those things that can be quite difficult to even know where to start or even to know that these opportunities exist in the first place. I know that if I was to jump onto Google right now, I wouldn't even know where to search to type it in to find it. So yeah, very interesting.
Yeah, thank you so much for that, Megan. And I can promise you all that I didn't pay her to say that. But I think it definitely is a bit of a barrier, having that word consumer, because I didn't identify as a consumer at the beginning, and I think a lot of us didn't. But to pick up on a little bit of what Jordan was saying around, what is the best way to actually recruit young health consumers? And how can we make our consumer advisory meetings more accessible for young people? So Ellie, would you like to speak on this first?
Thank you, Anya. I appreciate your role today, and I really appreciate being here. I would just like to say that I have actually been in the position where I have been the youngest person actually put forward into a role. I think the barrier to recruiting younger people would have to be, when you send out your EOIs, they sound like they've come from someone within Queensland Health. And, and the language that they use is directed towards people with an understanding of that language. There's often, I'd often look at things and go, well, they've sent it out to me and obviously they want me, but this language isn't very welcoming. Like, I'm not welcome and I'm not qualified. I think one of the barriers that people also face is, sort of connecting with other people as well, having the opportunity to come together in a forum like this and to debrief. Committees and things can be very cliquey as much as they can be welcoming. I think, the health professionals kind of live in a bubble, and so to break through that barrier, you really have to go, hey, I'd like to catch up, or I want to debrief, or so, I mean, we are welcomed, but we're not on the same token. And I mean, we do get paid very well, but, I think it is still quite a tokenistic role that we play.
Yeah, thank you so much for that, Ellie. I think, changing that language and making sure that we move beyond tokenism and are really valuing everybody's contributions is so important. Jordan, I know you have a great perspective on this. Would you like to share?
In terms of creating a supportive environment?
Yeah, recruiting people and how to make things more accessible.
Yeah, so there are a number of ways. Obviously, as Ellie touched on, the language is a really significant one. There's a number of things as well around environment. So if you're holding meetings in for example, a health service office, it's important to be really conscious that a young person may not feel comfortable there, especially if they've been treated at that particular location before. And it's also important, particularly with our age group, that there is a certain onus on services recruiting young consumers to be quite proactive in the way that they engage them, because you've got to really meet the young person where they're at in terms of their skill level, being conscious of the fact that things like setting up meetings, replying to emails are really skills that are developed later on if you join a particular workforce. And a lot of young people, particularly with complex health conditions, are still just learning how all that works. So really reaching out, having informal discussions before you start a process so that the young person knows what to expect is essential, as well as being really conscious about the complexities of the young person's experience, acknowledging that some topics are very difficult to talk about and that there needs to be an appropriate follow-up process to ensure that the young person is able to raise if anything concerning has happened during an engagement experience. They may not always have the confidence to reach out at the beginning when they're starting a consumer engagement journey to let you know if something's gone wrong. So it's really important that you create that safety and make them feel comfortable as you develop a working relationship.
That's brilliant, Jordan. Thank you so much. Keely, what's your perspective on how we can best recruit people and make things more accessible?
I definitely think Ellie and Jordan have both hit the nail on the head in different ways. I'm going to add to it with a little story of how I recruited 2 other Indigenous young people, which is often an underrepresented group. And it's simple as I texted my sister and I texted a friend and I told them about a First Nations consumer group. They both came along and they shared their experiences, and it was great to see Indigenous young people, especially young women, alongside me, to have people that look like me, light-skinned Indigenous women, is super validating. So in short, my answer is to encourage current young consumers to bring along friends and cousins and make sure that panels, groups, project teams, etc. are just really diverse.
Absolutely. Thank you so much, Keely. Our next question is really along the same lines of, how can we actually support young people, and what does support look like for you, whether there's been an engagement role or actually engaging as a patient with the health service? Megan, would you like to take that first?
Yeah, so I guess lining up with what everybody has sort of said, support's been a key word that has been used a few times there. So I think support in this space is a very individual thing, and extra care and time really needs to go into taking these things into consideration. So, is accessibility an issue? Do they have a vehicle? Can they actually use the internet where they live, as connectivity problems a thing? Language barriers, all those sorts of things, any cultural things, just to be aware of and to connect with on that level to start with, to understand how you can best support and get the best out of a person sitting in a role like this, because it can be quite overwhelming at times, I suppose, if you're not comfortable talking about things on this sort of level to start with, and getting people out of their shell to do that, that's a whole other thing together. So understanding the person that you're supporting is the core of that, I feel, and taking that time. I don't feel that there's really a blanket response to that question. I think from my own personal experience, what I've found is, again, as I just said, having someone take the time to actually get to know my story and understand what I feel comfortable sharing, what I feel comfortable talking about, and ensuring that, when there are topics that come up that might be triggering for me, that we are careful to work around them or specific in the wording and the language that we use.
Perfect, Megan. Thank you so much. Jordan, how can we support young people from your perspective?
From my perspective, yeah, it's pretty much exactly what Megan said. In a healthcare setting, again, it's so individual. It's really important to recognize that young people come into these situations or have been accessing health services for many, many years. And that has very profound impacts on the way that they relate to both the health service and to their own identity as a young person, how they've developed, their connections with school, community, family. So it really just comes back to this concept of person-centered care, but taking it beyond person-centered care into person-centered connection, to use Ellie's word, I think. So it's not just about how do we treat the illness, it's not just about how do we create a care plan for this young person, it's about, well, how do we work with this young person, no matter where they are, no matter what situation they're in, to meet the goals that they've identified. And that applies as well to consumer engagement. I think it's really important to engage people the way that they want to be engaged, and to also ensure that you're providing opportunities for them to see themselves in the projects that they're doing, to see the impact that they're having, and to be accountable essentially to that young person in that community as well. That something is going to be done with that engagement, because this is something we can run into sometimes when we do a lot of this kind of work is, you know, you'll put yourself out there, you'll be in that uncomfortable situation, you'll get through the awkwardness of being like an 18-year-old in a room full of health professionals, and then you just don't know what's going to happen with that discomfort. So really just always circling back and making sure that you're involving them at every step of the way.
Absolutely. Thank you so much for that, Jordan. I'd really like to hear from you, Henry, on how you've actually supported young people in the past and what you've found to work really well.
It's so important, isn't it? I think that for me, the underlying principle for all that is meet young people where they are. I talked before about developmentally appropriate healthcare, and for me, the values of adolescent health or healthcare for young people is that it's got to be strengths-based. It's got to be contextual and seeing that young person within the context of their health journey, within the context of their family and community and, you know, society writ large. About understanding their relationships, not only with yourself as a clinician, but the bigger part with who is the most supportive people in their lives. And then to make it skills-based. And there was a really nice example that Keely had before about feeling empowered enough to bring along other people. That's a skill to say, hey, I'd really like you to come along. So from those 4 values, and then of course being trauma-informed. And I would hope that all of healthcare, irrespective of age, is increasingly trauma-informed, but I think we need to be explicit in the adolescent, young adult space. So for me, keeping those values front of mind whenever I'm interacting with a young person and thinking about how I can advocate for them or care for them through the health system, that's kind of my priorities.
Thank you so much for that, Henry. And I just love how you said, meeting young people where they are. And in our youth reference group, we often talk about health professionals coming to our tables. We so often come to theirs, but let's try and reverse that and see, what priorities we have and what we can actually share and, teach from our lived experience as well. The next question that we've got is around quality adolescent healthcare. So what are the most important components of youth-friendly services to ensure that they provide quality adolescent and young adult care? Lachlan, I'd really love to hear from you on this, please.
I think that it's really important when, developing really good quality young adult and adolescent care is building a relationship with your patient and making sure that you take the time to do that, to understand where they're coming from, to meet them where they are, as Henry pointed out. I think it's really important to understand their needs and understand the context of them. That's really important. Taking, 5 minutes or so, sometimes at the start of a consult, or you start to build a rapport with your patients, makes them feel a lot more comfortable. And I think as a clinician, you can get a lot further in terms of treatment, in terms of understanding a patient's needs. And I think that's really critical. It's really important. I think if I could kind of condense it down into a few words, I think it's respect for patients, adaptability towards young people and their needs, recognizing and ensuring there is always agency in the decisions of your patients, and making sure that patients are always in charge of their healthcare journey as well as being stakeholders in their health, and balancing those two things is really important.
Absolutely, Lachlan. Thank you so much for that. And to go, back to the health professional perspective, Henry, to you, what are the most important components of youth-friendly services?
It's a question that it exists at a lot of levels about systems design and unit design and care design. I think from a pragmatic perspective, the two main things are ensuring that a young person's healthcare is confidential, and saying that every time you see a young person, and that might feel strange the first 3 to 5 to 10 times you say that as a professional, speaking to my professional colleagues here, but actually it's an evidence-based way of delivering better care. There's a really nice study from about 1997, and it shows that young people are more likely to trust you, and it shows that you care. That's the first thing. The second thing is see young people by themselves. If there happens to be a pediatric bent on the audience here, one of the greatest challenges is starting to allow that progressive individuation. And as a system, sometimes we don't do that very well. So acknowledging that pretty much from the first visit of high school, you can start spending some time with a young person by themselves. Set that up with the family and the young person. Have a standard approach to it. Don't make it a special thing. It's just kind of what happens in any time you see an adolescent. To me, at the coalface and the clinician work, those are the two things that change our care the most.
Great. Thank you so much for that, Henry. I think this really goes well into the next part, which is transition of care, because transition of care is such a crucial piece. I think often we can think of, caring for young people happens in the pediatric service, but it definitely doesn't. It happens across both. So how can health services improve transitions within health for adolescent and young adults? Brianna, would you like to answer this?
Yeah, sure thing. So very recently, having gone from having all my healthcare services in one place in a pediatric setting to try and transition across multiple locations of adult services. And with at the time, many milestones happening in life. You're finishing school, you're starting study, you're starting work, moving out of home, all these major things happening in a young person's life, as well as making this huge shift where I had a lot of appointments still, but across multiple settings that I was given some guidance on, but there definitely, I feel, this gap could have been improved through better navigation and information available, as well as clinicians and health services providing specific case management for people with complex or very large service use in the healthcare setting, and more information just for any to access or how to access any support available for people, adolescents and young adults undergoing that transition.
Yeah, thank you for that, Rihanna. I think it would have made a big difference for me if I had even another young person helping to guide me through that transition, because it's such a crucial time. Jordan, what was your experience of transition, or how do you think transition could actually be improved?
I could probably talk about transition for hours, so I'll try and keep that fairly brief. My experiences of transition were not ideal, and that was largely to do with the fact that my trust with the health service had actually been severed while I was still within their age bracket. As Henry said, trust and especially respect of confidentiality is incredibly important with young people, and unfortunately in my case that wasn't dealt with very well. However, that did significantly reduce my ability to plan for a transition to adult services, and it meant that the services that I was being referred to and the discussions that we were being had weren't really relevant to the actual experiences I was having at the time. So ensuring that you've got a good rapport and that there's a trusted professional to be having these conversations with a young person is incredibly important, and it needs to be done very early in the conversation, honestly, ideally a year before they turn 18, because the ways in which the experience changes at that age, everything happens very, very quickly. So in my case, I moved out of home when I was 17. I picked up 2 jobs. I'd just gone from practically no access to high school because of my healthcare experience to being enrolled in university and having a full-time workload, while trying to manage this transition between the pediatric and the adult healthcare system. So it's really important to ensure that the young person has the skills required to manage that transition. And when I say skills, I mean very practical skills, ensuring that they have a Medicare card, ensuring that they're applying for a healthcare card if they need one, ensuring that they have financial security, trusted adults to ask questions of after they've been discharged from the service, and social supports who can help deal with this social element of it. Really recognizing that the best way to equip these young people to deal with that transitory part of their lives isn't just about health service referrals. It's actually about all the other things that are happening at the time that can make sure that it's safe, to make sure that they have appropriate housing, and to make sure that they'll be doing things that they enjoy, so that all the other factors that contribute to good health are being supported while they're in this really difficult stage.
Absolutely. I think you can see the applause, and there are beautiful comments in the chat supporting what you just said, Jordan, because it's more than just, a young person in a health service. It is incredibly holistic. We still have lives when we leave the hospital. Lachlan, what is your, take on transition of care or your experience? How can it be improved?
Thank you. I first want to really thank Jordan for that response, because I think it really articulates so many of our experiences as young people that are first starting off in the healthcare system, sometimes as everyday users for the first time. Trying to navigate and understand this complex system is really difficult for young people. And I think there are some structural changes that need to be made in the healthcare system, whether that's public or private. And I think there are some approaches that clinicians can also take in mind to change that approach as well, without the structural changes or alongside them. So I'd like to, acknowledge the important work that Henry's doing at GCUH on the Gold Coast. And I think it's amazing that Queensland Health has taken the initiative to sort of pilot a designated program for transition of young people. Because, in Queensland Health, it can be very difficult to have that 18 cap, and you are kind of quickly transitioned into the adult system. Sometimes, if you are first presenting to hospital and have a medical diagnosis at 17, for example, that can be a very abrupt transition out of pediatrics. Even if you get it, you might not even get into pediatrics, which can be difficult as well. So to have that, though, any program that develops a designated transition, whether it's 15 to 20, or whether it's 15, 16 to 25, as the MARTA does at their young adult centre, I think it's really important to have that structural change in our system, in our healthcare system. And I think it's incredible that Queensland has done this as an Australian first, because I think it is really important. The other thing that I think is really important, and my younger brother is going through this at the moment. He is transitioning out of the pediatric system into the young adult system, and it's a really difficult journey. It can be, because you have a life of complex medical conditions, and for parents or family to transition that medical burden, that is a really big thing for clinicians. I think that they need to be aware of that there is that transfer of agency, not just for the patient, but also for the parents. They're passing on that burden, and you have to be, as a clinician, you have to be a part of that journey to help prepare the patient to take that on and to feel supported in their health conditions and in their health journey. I think that transfer of agency is really important to be aware of in any clinician-patient-family relationship.
Absolutely. Thank you so much for that. I definitely agree that transfer of agency is so important, and how you spoke about, the 17-year-old with a new health condition presenting to a hospital, that could be a very, very rough transition. And in my situation, I was looked after by pediatric, services for a while, and then I was discharged because I was doing well. And at 15, I became unwell and I was put straight into the adult system. So it was an incredibly abrupt transition. And we actually have a wonderful question from the audience, and that's on, do the young people on the panel think that youth advisory committees are required, or is having young people represented on a consumer advisory committee enough? Megan, I'd love to hear your perspective on this.
So I am of the opinion that yes, I think it is important and that these community advisory panels are required. And a part of that reason, I believe, is because it creates that safe space that we're talking about. It gives us that opportunity to build up those relationships and the rapport with the people that help to advocate and amplify our voices better. It helps us to have opportunity to discuss, possible questions we might answer, also formulating and helping us to articulate our opinions to make it more digestible, understandable, and easier to process. So if you take somebody who hasn't got that experience and put them straight onto a panel without, having that skill set, it makes it very difficult, and it can be really, really confronting and scary. I have some previous experience working on different advisory panels when I was quite young, and I was really enthusiastic and keen to get onto it. They didn't have a safe space like this. And I was put out into the open, the youngest person in the room with mostly older people who were far, far my senior, and it was extremely intimidating. And every time I raised my voice to raise a topic or an issue, it was concerned that, maybe I wouldn't be taken seriously, I wouldn't be heard out, or maybe what I had to say wasn't as important as the next person. So having these setups that we have, I think it's crucial, really, really crucial, particularly in this demographic.
Great. Thank you so much, Megan. Tanya, I'd really love to hear your perspective on this. How have you created safe spaces, and do you think that a youth advisory committee needs to be separate to a general one?
It's a really great question, Anya. So thank you to the person that submitted it. Yeah, look, I absolutely think that separate youth advisory councils are really important. We have some at the Children's Health Service, including our Beautiful Minds Committee for young people who have had lived experience of a mental health condition. And I think, psychological safety and a safe space to be able to listen and learn from the experiences and the lived experiences of young people is extremely important. I'd also say that if you are able to set up specific youth advisory councils, you're really able to get to the heart of what matters most to young people, and that's likely different to what matters most to in a not a youth context, certainly at CHQ, potentially to parents. So yeah, absolutely. I think if you can, that's really important. And I know that a number of health services are actually setting up youth advisory councils or those by another name. And so I applaud those health services for doing that. I also do think that if there is trust and safety within a broader advisory council, that young adults can be brought into those conversations as well. And we've certainly had success around that with our COVID response and setting up COVID consumer panels that had both the voices of parents, but also young people as well. So I think you can do both, but yes, absolutely. I think there is real benefit in youth advisory groups.
Great, thank you for that, Tanya. I really hold the perspective of, both is necessary. You can't necessarily just isolate us. You need to integrate us as well, but we do need that space where we can, have our voice. Lachlan, sorry to catch you while you're drinking your tea.
That's all right.
I'd love to hear your perspective. Do you think they need to be separate, or how would you go about it?
I don't think they need to be separate. I think it's important to have it's important to integrate youth co-design and involvement in all tiers of the healthcare system. I think wherever you can hear from young people and incorporate that, whether it's more formally or whether it's informal consultation, I think that's really important to keep in mind. It doesn't have to be a table. It doesn't have to be a formal council. It can be, but I just think it's really important to understand and to be aware of that. Some people may not feel comfortable to sit on a council and on that table. Some people may, as young people, may feel more comfortable giving feedback to their clinician or feedback in a myriad of forms. So I think it's really important to, again, meet young people where they are and where they feel most comfortable to share, and really listen to young people at every stage and every level of the healthcare system. And I think the more you open up, you know, in terms of listening and engaging, there's so much benefit to come from it in terms of improving the healthcare system. As young people who use it day in and day out, we often have some very helpful insights, whether that's, you know, saving money in the healthcare system, whether that is, you know, reducing service duplication, whether that is, you know, developing a better relationship with your patient or other patients as well. There's some really great insights to tap into, and it doesn't have to be in a structured way. It can be informal and structured as well.
Great, Lachlan. I couldn't agree more. I think it's needed at all levels. And I just wanted to give a quick shout out to Trisha in the audience from Westmoreland Health, who set up a youth advisory council. I had the pleasure of meeting her for the first time, and I heard that she'd set up a youth advisory council, and I just felt so much pride because I think we didn't have this a few years ago. This is a really big credit to everyone's advocacy, whether you're a young person or you work in the health system, and you've actually created spaces for young people to be heard. So thank you so much, Trisha, and for everyone for the wonderful work that's being done. So our next question really is around inclusivity and accessibility. So how can services be more inclusive and accessible for all adolescent and young adults? Keely, would you like to take this first?
Yeah, sure. My main point is to make sure the people that are delivering healthcare and health services reflect the people that are actually using it. So for Indigenous Australians, this means more Indigenous health practitioners, and not just in community health roles or identified Indigenous roles, but as GPs, midwives, surgeons, every single role you can think of. I would love to see an Indigenous man and an Indigenous woman in that type of role. It's so validating and energizing to see someone who looks like you giving you your healthcare. It also means they're probably more likely to be privy to your own needs and wants. And I also want to speak to, in that kind of line, to a question that's come through the Q&A. Does the health system engage with young people of colour to hear and build from their consumer feedback? I'm reading a submission from Ari, our tech support for this webinar. She sits on our youth working group and identifies as a person of colour. The health system can definitely improve on the person of colour engagement, as it is very difficult to feel seen in the healthcare setting when there are probably 1 to 10 people of colour to non-people of colour. I've personally not found that any extra effort has been made to reach out to the people of colour community, and focus on people of colour doesn't seem to be a priority to Queensland Health.
Thank you so much for that, Keely, and thank you for sharing that as well, Ari. We're so grateful to have you here as our tech support, and I think you raise a really important point that more work needs to be done. Ellie, what's your experience, and how do you think that our services can be more inclusive and accessible?
Oh, that's a loaded question. I think for me, especially having physical disability, it doesn't have to be a big grand gesture. Sometimes we don't need to like build a new building or whatever it is. I think COVID is one of the best things that ever happened to the health system. You know, in the context that, you know, we had to find a different way of doing things. So accessibility to me is being asked how I want to attend an appointment. Often I'll be, you know, but I might have a consultation, but I might have an issue and I might want to come in. So I'll go, oh, I really want to come in, you know, and we make it work. But it doesn't necessarily have to be, you know, here's a text and you turn up at an appointment at this time. You know, you have to sort of have a more holistic approach to your healthcare, to say, how does that person live? What barriers are there for that person? And, you know, what are their preferences? So I think it's really about personalising healthcare, and it doesn't necessarily have to be like the title of this webinar is Reimagining Healthcare, but I don't think you have to use your imagination to really make a difference.
Absolutely. Thank you so much for that, Ellie. And I definitely agree with that thing that you've said around asking us, you know, and I think we've had telehealth so rapidly evolve, and what's missing there is the patient's voice and actual choice in choosing telehealth. But that's my own little soapbox. So as you can probably see, we do have a lot of diverse voices and perspectives on our panel, but we do acknowledge that we don't represent every group, and there are people that aren't on our panel tonight. However, there are so many groups of young people that are underrepresented and aren't at decision-making tables generally. So how can we actually represent those voices and amplify them when they haven't been heard necessarily before? Keely, I'll go back to you on this one.
I'm here tonight as the only Indigenous young person, and I'm really privileged to be here, but it does highlight a gap. I've lived a vastly different life to other Indigenous people, but it's not to say that there's no Indigenous people like me. It's just to say that I'm just one person representing, in essence, over 600 diverse cultural groups after only having access to the Inangai people and the Yugara people. To amplify Indigenous voices, I think it's important that we recognise the diversity of Indigenous voices and don't stop at just having one consumer rep who identifies or one practitioner in a team that identifies. It's about creating a space where Indigenous people feel welcome and heard, but also there needs to be follow through. I personally like to know that organisations or projects will consult other Indigenous people and that it's not going to stop at me and that it'll be continued throughout the entire project. I love to know that it's actually authentic. I think this can be said for most diverse and underrepresented voices.
Absolutely, Keely. Thank you so much. And, I identify as being from the disability community, but I know there's so much diversity there in what I may feel and think does not represent the voices of everybody. And on that, Ellie, how do you think that we can amplify the voices that haven't been heard before?
I think in the context of people with disability, whether that be physical or whether you're blind or whatever else it is, I think some of the barriers for people with disability is accessibility. So have you taken into consideration that someone might be deaf? And, have you thought about how do you bridge that gap? Do you use like a relay service, or someone might be non-verbal, but it doesn't mean to say that they don't have something to contribute. So what kind of platforms and things are you using? I think a lot of our platforms and our modes of communication are still very rigid, and I think that we have to be creative in the way that we approach that. I think it's still very individualized, and unfortunately I think that's why a lot of disabled people don't contribute. It's because, how does someone meet me halfway? Do I even bother turning up?
Yeah, thank you so much, Ellie. You raised some really important points. And I think that kind of links into how we can actually be there to educate people as well. And there's a wonderful question that's come in through the chat box on someone would really like to know the panel's thoughts on how we can involve youth in the teaching and training of health professionals delivering their care. This could either be in the hospital environment or during their training at university level. Henry, I might pass to you first on this, if you don't mind.
Thanks, Anya. Look, it's such a fascinating question. I'm lucky enough to be teaching around adolescent young adult medicine to a whole range of professions, including my senior colleagues down to first year medical students, as well as allied health students who work in my units. And it's a privilege. How do we involve young people in that? Well, I would say that the vast majority of students are in fact young people. And what I find when I'm teaching med students is they tend to be better at adolescent young adult medicine or the principles thereof than their more senior colleagues. And that's because they're still living it. They still have the ability to see young people as young people first, and then diseases and everything else second. And my hope when they come to our unit is that they get enough of that kind of teaching so that at the other end of things, when we've learned all those life-saving lists and done those many years of night shift and seen and experienced the challenges and trauma of our healthcare journey from the professional side, that we can still have that skill of seeing a young person as a person and meeting them where they are. I think that one of the challenges then is having an increased exposure for people just like you guys to be in the educational space. Because this is an advocacy space primarily, and you're doing phenomenal work. But translocating that into the educational space as well just enhances that, and it makes it really pragmatic and is those sort of really concrete tips about how people can deliver better care.
Absolutely. Thank you so much for that, Henry. You make some really, really good points. And I'd like to do a quick shout out to QCYCN, who are running a webinar series at the moment. And they've actually engaged with all of us young people to have interviews and to have our voices heard and have that included, in the education. Jordan, do you have a perspective on how youth can be more involved in teaching and training health professionals?
Yes, I'm particularly passionate about this one because I am also currently studying a public health degree. I'm actually in my first year, which is a bit embarrassing to admit, but that's where I'm at. So I do agree with Henry. There is a certain level of assumed knowledge because many students are young people, but I really think that it's important that we be very, very committed to lived experience, engagement and representation at the front of the classroom from the beginning of the degree. It's one thing to be able to, understand and respond to young people and the complexity of their lives outside of the health system, but it's really important to respect people's diagnoses as well. So, for example, I recently took a psychology course, and it was quite confronting seeing the things that I lived and experienced described in such a clinical and dispassionate way. And to know that the young people around me were essentially being taught that that's what it was. When I was a living, breathing example of how things could maybe be a little bit different. There's also definitely a place for lived experience, and this is already kind of starting, but needs to grow a lot further. Lived experience, leadership and research, and partnership with consumers in research, so that the academic material that people are reading and writing about constantly has that thread back to, well, this is what it actually was to live this situation. This is what the qualitative data says. This is the experience of the people who went through this, and this is how we've managed to systematically review this and provide something that we can use and constantly come back to. That's a really good example of what the experience is like. And finally, I really want to emphasize the importance of lived experience in training and professional development throughout the course of a professional's career. It's very important that you do, obviously, a lot of the people in the audience today work with, young people every single day. They know what it looks like. They know how to do their jobs really, really well. But sometimes it's important to have that reminder, to hear that story, that voice, to bring it back to the reasons why we do these training about language and systems change. And when it all can seem quite nebulous if you don't have the person right in front of you saying why it's so important, how we can actually do something about it, and why it's essential that we're involved in making that happen.
Thank you so much, Jordan. I had so much I wanted to pick up on from what you said, but you kept going and I just kept absorbing more information. And yeah, I just definitely agree. Lived experience has to be put front and center, and it humanizes textbooks. It humanizes, what you're learning. Keely, I'd love to hear your perspective.
Like Jordan, I'm currently studying at university, and I have many more years of study ahead of me before I'm a practitioner out in the real world. But I haven't had any compulsory training on how we can involve youth, or really anything about the power of youth voices and lived experiences. I've personally sought out roles in those kind of spaces and completed trainings about amplifying youth and Indigenous voices. But I would love to see these kind of things compulsory, especially for groups that don't identify with the training target group. So, for example, older practitioners and clinicians undertaking youth engagement or inclusion training, non-Indigenous Australians undertaking Indigenous engagement inclusion training. Like Jordan has stressed, people with lived experience need to be involved in the creation and delivery of the training sessions that are about them. There's a really powerful statement among Indigenous communities that I think sums this up really nicely, and it's nothing about us without us.
Absolutely. I feel like I plaster nothing about us without us over everything. And you're completely right in everything that you've said, Keely. And I think that lived experience just needs to be centered. And I'd like to challenge the audience to actually reflect on how often the content that you learn from is designed either with or by people with lived experience. So while you ponder that, we're going to go to another question. And it's, how does the panel think that the current resources need to be adapted for young people with learning needs? And this one came through the chat. Megan, what's your perspective on this?
So I want to say thank you to the person who submitted that. I believe that was Georgia. I saw that and immediately I resonated with that question. I was one of the main people in my younger brother's life who assisted with his early stages of development and diagnosis of autism. We got to deal with a lot of complications throughout that time. And I think something that's really important is to understand that regardless of the diagnosis, there's still a person with needs, wants, and aspirations and goals, and they feel everything very, very deeply. And sometimes it just takes the time of someone to slow down and just explain things on their level in a digestible way that they can articulate things better for themselves. The biggest thing I found with my brother is that he is so smart. He's one of the smartest people I've ever met. And people completely underestimate him all the time because sometimes he doesn't stay, it's not on the same level that you meet at. Like I might be on this frequency and he's on this frequency and we're talking about the same thing, but we're just not matching up. And I think it just comes down to taking that time to listen and try and see from their perspective where the disconnect is in what they're not understanding, and trying to rephrase or reframe the way that you produce that information or share that information. And from a resources perspective, it can come down to as well, you know, if you have a resource that's available that you've used and provided to parents or carers or other people who have digested it well, if they are showing cues or traits that they're not understanding what they're receiving, it's learning how to pick up on those cues to take the time to break it down more. And if you're a person who is living with autism or have those issues as well, it's one of those things to feel heard and feel understood and not be made to feel like you're any less or any different. And it's having those words carried out in a way where it's not belittling you. You're speaking as their equal. And I think that's a really important thing that's often overlooked, and people don't have the patience and sometimes the time in hospital environments to really slow down and do that in the right way. I'd love to pass across to Jordan as well. I think she would have some really good perspective on this too.
Thanks so much, Megan. And I would also like to acknowledge that neurodiversity is such an important component that really isn't addressed appropriately, I think, in specifically psychiatric services, which was the context, I think, of this question. So there is, I think, a lot of work that needs to be done in creating specific ways and appropriate ways to engage neurodiverse people, and ensuring that it's seen as a distinct and legitimate experience that needs to be appropriately accommodated, and that we're really not doing enough at the moment in a lot of settings to make sure that there's equivalent access, basically. And I'll touch on this a little bit later, but there have been, some major recommendations passed down specifically as related to neurodiversity in the mental health system and how that pertains to young people. And I think it's important to say it is definitely a key focus, and we need to change the way that we do things to ensure that it's highlighted, that it's appropriately respected, and that there's a safe place, not just in health services, but in systems change, in consumer organization and engagement, to ensure that those voices are being appropriately heard.
Thank you so much for that, Jordan. And you touched on, we need to start changing, whether it's systems change or cultural change, which leads beautifully into the next question, which is actually around cultural change. So what is meaningful cultural change, and what does it look like and feel like for you? I'd love to hear from Lachlan on this first, please.
Thanks, Anya. I wanted to kind of start off by saying I think cultural change and shift in the healthcare system is creating these new norms. I want to see all of the things that we're talking about and all of these beautiful insights from our panelists. I'd like to see a lot of these integrated into the healthcare system as new norms and as the, what is done, because that would be a great cultural shift, and to take that insight and knowledge not just as a one-off or as a, as a this youth consultation funding has expired or lapsed, so we don't need to do that anymore. We've done it. We've ticked the box in terms of doing co-design and doing that youth engagement, but having it done consistently and integrating it into our healthcare system year round is really important, and I would love to see that as our cultural shift. I also like to kind of draw attention to, I use this as a great example in terms of seeing a cultural shift and also emphasizing not just co-design, but having meaningful co-design. I usually like to point to Hart's Ladder of children's participation. For those that aren't aware, it's a great illustrative tool that shows a sort of tiered levels of engagement, and the lower levels of engagement on Hart's Ladder are more superficial. They don't give young people the level of a lot of agency and a lot of control over the decisions in that co-design space. You want to be achieving or striving for those higher levels of Hart's Ladder, where young people take on more active roles, they have decision-making capacity, and they are, really becoming stakeholders in the healthcare system in a much more meaningful way. So I think having those higher levels of meaningful co-design, not that box ticking co-design and engagement, is a really important cultural shift to have.
Yeah, thank you so much, Lachlan. I've been working on a co-design framework, and I think that I should have recorded that and put it into the framework because that was excellent. It is a cultural change, and to start doing genuine co-design requires equal partnership, equal governance, partnering in absolutely every way. And it takes accountability to lived experience and really listening to those voices. Megan, what cultural change do you think is needed, and what would positive cultural change look like and feel like?
I want to start off by saying I really resonate with everything you've just said, Lachlan. A lot of what I have to say aligns very much with what you've just sort of, again, articulated beautifully. From my perspective, I think the only other thing, it really comes down to that communication. And I've touched on it a few times throughout this panel tonight. Having that time to really break down and see it from the other person's perspective, and taking into consideration their thoughts, their feelings, how they're digesting that information, the type of, what they have available at home to them in resources, who's able to help them through that time, all of that sort of stuff is all really key. And a lot of that is very largely overlooked at this current point in time with how our health system works. Like an example, my first really major admission to hospital, they looked over my most basic tests because I was a young female and otherwise looked healthy, and my basic tests were healthy. They sent me home and I came back not long later with a major heart problem. And I think having that cultural shift as well, to understand that, I understand the wait times are long and our staff are busy and we don't have all the resources and time in the world, but we are people and we are there for our individual needs, and we're there because we have to be or feel we have to be, not because we want to be. And we're not just there, like that's your job day to day. This is our lives that's it's impacting. And I think taking it to that level of that fundamental understanding and having that shift there, rather than going, oh, it's another person, and walking them in and out, and helping that continuous care come as a result of that visit, rather than you just walk out the door and then that's it, nothing continues. Helping to bridge that disconnect in between as well is a really important cultural shift that I think needs to happen as well.
Absolutely, Megan. And that point, it may be your job, but it's our lives, and the interactions that we can have in the healthcare system often stay with us for the rest of our lives, or we're all young. It's still staying with us now anyway. But Henry, I'd really love your perspective. We've heard from the young people about what they feel is important in cultural change. How can we actually do this in a meaningful way in large organizations? And what do you perceive as the needed cultural change?
I think cultural change needs to happen, and we know that because that's what we're all here for. Changing the values from which you operate is kind of what's required there. And I've talked about those values of youth-based healthcare and care for adolescents and young adults being about strengths-based, meeting them where they are, so seeing them, young people, in context, forming clinical relationships and understanding their relationships and empowering and doing the skill-based, taking it from a skill-based approach. And I know I'm saying the exact same things I said right at the start, but to me, that's the culture that we want. And we need to bring that into our lens every single day, every time we're seeing a young person. That's the whole story. That's what developmentally appropriate healthcare is.
Perfect, Henry. Thank you so much. I think we should get you a shirt that says meeting people where they are, because you've just absolutely drilled that down tonight. And I think it's such a crucial point. So with a cultural change, we need to look at the current state of the system and learn, what we shouldn't be doing. So Rihanna, I'd love to hear from you on what should health services and health professionals not do when they're providing care to adolescent and young adults, and also just engaging with young people in general.
So I feel that a lot of people have opinions about what young people are, stereotypes and assumptions and things. And I'd really love for that in healthcare to be put aside, as seeing not everyone with the same diagnosis or the same sorts of issues is the same person or has similar experiences. Personally, having a brain tumor, I didn't have some of the symptoms that are more commonly seen in other young children who have had the same condition. And because I was a teenager, that was overlooked. So just really individualizing care to the patient and looking at it holistically rather than just looking at the symptoms and looking at the patient, kind of really working with the patient to understand what's going on for them and what could be happening on a medical basis would be really helpful.
Perfect. Thank you so much for that. And I think that really ties in well with what Megan was saying before, that so often, because we're young, we're automatically perceived as healthy. And that can limit, the diagnosis and how we're investigated for different things. Lachlan, what are your perspectives of what health professionals should not do, whether it's engaging or providing care?
Well, to kind of add to what Brianna has said in terms of listening to patients and creating a plan of individualized care, I think that's really important. One of the other things that I found to be really important, or what I'd like to see clinicians not do, and this unfortunately comes from personal experience, where I was, for the first time, I was seeking help from a clinician for mental health support, and I wanted to access a mental health care plan. And I started talking to my GP about that, because that's the way we have to do it. And it's already a confusing enough process in terms of starting to get a mental health care plan. But I think it's really important for clinicians to try and balance the system, system side of healthcare in terms of the forms and the Medicare and the paperwork and all of that sort of thing, but also listening to patients. So what happened to me is I said to my GP, I said, I'd like to see a mental health professional for these personal reasons. And he goes, do you have anxiety? And I said, no, I don't have anxiety. Do you have depression? I said, no, I don't exactly have depression. These are the things that I'd like to discuss with a psychologist. And he put down anxiety on the paperwork, because it was easier to tick that box and to put that into the paperwork, because something had to be put down on my mental health care plan. And for him, rather than listening to my needs and what I actually wanted to talk about with a mental health professional, it was easier to tick that box and to say anxiety, yep, done, he qualifies, and give me my paperwork to see the mental health professional. And then when I saw the therapist, they said, oh, okay, I see that the doctor has notated you suffer from anxiety. So already with that mental health journey, we were off to a wrong foot in terms of starting with that therapist. And I had to say, no, I don't actually have that issue. It was just easier for the clinician to put that down, to qualify and get the paperwork done. So I'd really urge clinicians to be considerate of that and keep that in mind when they're working with their patients. I completely understand that Medicare and our healthcare system can be difficult, and sometimes you do have to have that paperwork involved. But to be conscious and trying to balance paperwork and translating the needs and kind of desires of the patient into the system can be difficult. And I think I just ask for mindfulness from clinicians in dealing with that, because it can create issues for patients. And I know sometimes, clinicians, their hands are tied, but it's important to be mindful of those sorts of things.
Thank you so much for sharing that, Lachlan. And I think it is, adjusting the structure of what you actually need to get a mental health care plan, and can we be a little bit more open? Because I had a very similar experience to you. I saw a specialist at the hospital and they basically said, you've got so much pressure from all of this other physical stuff going on. Have you ever thought of talking to someone about it? And I thought, no. But they sent me to my GP. I sat down, was told to ask for a mental health care plan. I asked and they went through the same thing. Do you have depression? No. Do you have anxiety? No. But I've got quite extreme stress. And they just said, well, you can't qualify. So I walked out that door and I've never had a mental health care plan. And it was that experience that really changed things for me. So it saddens me to hear that that's happening so widely across the board. I think that goes really, Henry.
Sorry, I'm just going to jump in. I couldn't get all the way through a panel without doing it. I think the challenge is to sit in that space of both diagnosis and formulation. And diagnosis is what doctors love. It's what the healthcare system relies on. It makes things black and white. It allows us to do evidence-based care. And then formulation is why this individual with this diagnosis is different from every other individual with this diagnosis, and in fact, different from every other individual in the universe. And good care exists in the middle. And if we're going to do good care, we need to be talking with young people about what that means and exploring that nuance and acknowledging, hey, look, Lachlan, I hear that you're saying that you don't have anxiety, but I'm going to have to put it down in the plan, and here's why. When you get to the psychologist, make sure you explain that. And that way you and your GP and your therapist are all marching to the same beat. And you trust the system more, and you get the care that you want. And if we could spend those extra 30 seconds across the system in every consult, then I think care would be so much better.
Yeah, thank you so much for that, Henry. And it's really, coming to the middle. And what I found in my experiences and really heard from the community is that it's really hard to get a physical diagnosis, but it's really easy to get a mental health diagnosis, I think. And I think it's disappointing because it is coming into the middle for all health conditions. It really rolls in nicely to the next point, which is actually around, this announcement in the Queensland, from the Queensland government that we're going to have the highest spend in mental health, which is incredibly exciting. But how is Queensland looking to reimagine how we support young people accessing mental health services beyond those 20 sessions obtained through the mental health care plan? Jordan, I'd really love to hear your perspective.
So I think it's important to flag, first of all, that a lot of this transformational work has been happening for years behind the scenes, and this announcement of this large mental health expenditure, that is because of the advocacy that young people and mental health advocates have been doing for actually decades now, to really raise this as a major public health issue. For anyone who isn't aware, I'm sure that this is, a very clued in kind of audience, but we also recently had the parliamentary inquiry into the mental health system in Queensland, which passed down a number of recommendations about how we can reimagine the mental health system. And quite a few of those recommendations do relate specifically to young people. And some of those recommendations include reevaluating and being more flexible around that age cutoff between healthcare services. So we already see services like Headspace who do take young people up to the age of 25, which is quite different, obviously, than a number of other public services. Some of the other recommendations include what I mentioned earlier around neurodiversity, a significant investment into the alcohol and other drug sector as it pertains to young people, and better cooperation with universities. So it's important to see, now that we're at this pivotal time that the recommendations have been handed down, how we can get young voices and mental health advocates involved in ensuring that the implementation is smooth, that we're able to see budget announcement like this more into the future, and that on the other side of this, we've got a mental health system that's appropriate for everyone and responds to this particular stage of life.
Thank you so much, Jordan. I always learn so much from you every time we speak. So thank you for sharing that information about recommendations, because I feel like a lot of the time, as young people, we aren't necessarily aware of what's going on in the space and the system. And in saying that, Henry, I'd really love to hear from you on how you actually see reimagining mental health services.
I wish I could give an answer as sophisticated and as thoughtful as Jordan. I think For me, the priority is this is a big amount of money, and it should grow our system significantly. There's that striking difference between pediatric and adult mental health services that many of us have borne witness to or experienced. And so in keeping with developmentally appropriate healthcare, something in the young adult space would be essential. I've said before that I think that the pointy end of mental health services for very severely mentally unwell young people does a reasonably good job, certainly in the pediatric space. But I also think that at the clinician level, our ability as non-mental health professionals or non-specialist mental health professionals, our ability to manage young people with mild to moderate mental health concerns needs significant improvement and support across the entire system. And so for me, that is where the bulk of that would form the foundation of providing, good enough mental health care for the vast majority of our population.
Yeah, thank you so much, Henry. Always so insightful. Rihanna, would I be able to get your perspective on this quickly?
Yeah, absolutely. So I was just going to reiterate what Henry said, basically, that the vast difference between pediatric and adult care, especially in the mental health environment, and that really one of the changes that I feel would be really helpful is shifting from those very severe, sometimes very confronting, really adult psychiatric care into basic, more moderate mental health care that is seen as less severe, but just as important. And that really the environment in which people are approached about their mental health, and when you go into a department an emergency or situation for your mental health, rather than sitting in a medical ward, sometimes it might be easier if, obviously, if permitting, to move into some quieter space or somewhere that's less confronting or with less medical craziness going on that sometimes can occur in an emergency department, into somewhere where you can have a basic conversation and sit down with someone and genuinely connect, rather than a few nurses or different people seeing you and having to tell them the same thing that you've told the last 3 people, and getting a really connected support network from the clinicians, instead of just a very disconnected, confusing sort of situation. Yeah.
Thank you so much for that, Rihanna. And I think that ties in beautifully with that point that Ellie made in her first vision statement around, it's about human connection. That's really what this boils down to. So Tanya, this next question's for you, because as the Director of Allied Health at Children's Health Queensland, what are some of the lessons that you've learned in engaging with young people?
A great question. And we spoke about cultural change before. From my perspective, absolutely cultural change is required, but I'm convinced that we've started on the journey, but this takes, a transformational change takes a long time. So I'm really confident that we've started, but we've got a long way to go, really, to be able to have a whole system that is more deeply person-centered. I actually have written down a whole host of notes, even in listening to the young people on the panel tonight. And there's a couple of reflections I have that I'd like to share. And the first one really goes to what many people, including Henry and Jordan and others, have said, and that's really about always learning. And so that's a real reflection for me in working with young people, and particularly in around consumer engagement and co-design, that you're always learning, and always really make sure that you listen, and actually listen in a really meaningful way. And so, panels like this tonight are a great opportunity for all of us to listen deeply and to learn from and with each other. I've also learned that actually don't reinvent the wheels with some of this. There's some wonderful resources that are available, including the Health Consumers Queensland Youth Reference framework that was developed. And also, like, reach out to your peers. I do this all the time, and there's quite a momentum now of both consumers and staff in healthcare that are sort of interested in the voices of youth, as they should be. And so really find ways to connect with them, and of course through to Health Consumers Queensland. The second thing I want to say is I've learned in working with young people to be truly person-centered, to really listen to the perspectives of the young people and actually ask them. I think Jordan said this, but ask them actually how they want to be engaged, because actually, you know, they've got you'll have the answer first of all, but secondly, you know, they've got some really great ideas, as you know, we've heard some of them tonight. Thirdly, I would say, and this has been touched on as well, around diversity, but really try as much as possible when you're engaging with young people, and this really goes across any sort of work around consumer engagement, to try and get as much of diversity of perspective as possible. And I know that's hard, but really be tenacious about trying to do that. And the final thing that I'll say is that I think it was you, Anya, that sort of said, you know, the phrase is "a lot of us do." It's quite a well known phrase about nothing about us without us. But truly, I think if you think about that when you engage with young people, and this is a lesson for me, you've really got to live it. And the best way to live that is through, in my mind, is through co-design. And there are many fabulous examples across Queensland and Australia, and indeed the world, of where co-design has been so important. I know at CHQ, our partnership with young people in the building of Jacaranda Place, with a range of whole other stakeholders, was a great example of co-design of a building and of a model of service delivery that really works. Whether it's redesigning of a ward, redesigning or reforming a whole service, or actually, you know, co-designing, you know, social media posts and things like that. I think, and there's different ways you can co-design, of course, but actually, I think the key to this is listening deeply and partnering, I think, you know, in summary. So there are a couple of my reflections, but yeah, as I say, I've taken a whole heap of notes. So I think if we all can commit to continuing to learn from and with each other in a genuine way, I think that's going to set us up pretty well for success.
Thank you so much, Tanya. I'm just so glad that we've got this in a transcript so we can all go back and listen to all of your absolute gold nuggets. We're coming to a close, but before we close, I really would like to go to everybody on our panel and get a 30-second to 1 elevator pitch of what is the shared future direction or the vision to make the health system better for all adolescent and young adults and those caring for young people. So the first person I'll go to is Keely.
Mine has definitely been said a few times, but it's nothing about us without us. That would be my little nugget. Yeah, thank you. I might throw it to Megan.
Sorry, my internet just cut out then. Do you want to jump over to the next person and I'll jump back on?
No worries. If I could please pass to Ellie. You're on mute. Yeah.
Story of my life today. I would just say share your power. As a clinician, as a doctor, as a nurse, as any health professional, share your power. Like, knowledge is power, right? So if we share our power with each other, it's only going to make us better as people and as individuals, and then to be able to go on and share that education or use that to better advocate. I think it's really important, and that's what I really like to see in the system, because at the moment there's the healthcare system is there can be quite a lot of inequities and power imbalances, and I think that's a barrier at the moment. So I think I would just say share your power and share your knowledge and understanding, and give your time. I think your time is your most valuable resource before you pick up any diagnostic tool. Use your ears.
Beautiful. Thank you, Ellie. Megan, we might come back to you on your elevator pitch.
Thank you. So for me, it would just be seeing more of that support and communication and engagement with the AYA category, but in patients in general as well. This isn't isolated to our age demographic, even though we're focusing on this in this session. It's across the board for all of your patients for holistic healthcare, end-to-end management. That is what I want to see.
Beautiful. Thank you, Rihanna.
I'd probably just say that the vision for me would be seeing AYA consumers treated as mature and coherent people. We're not children and we're also not geriatrics. We can actually understand some things even without that medical background. It's all about just communication and working cohesively to achieve the common goal that we all have as you do as our health professionals. So yeah, that's probably all I'd say.
Thank you, Rihanna. Tanya.
I think we just need to continue on the journey of amplifying as many voices as possible. As I say, learning from and with each other. And yeah, it's a journey, but we're well and truly on the road.
We definitely are well and truly on the road. Jordan.
Really just echoing what Brianna said about respect. Respect our ability to make decisions, respect our agency, respect our professional expertise, respect our lived experiences, partner with us genuinely and don't treat us differently, while also making sure that spaces are safe and inclusive and acceptable for everybody so that we can share power appropriately and at the same level so we can make shared decisions around the services that are going to affect our lives.
Beautiful, Jordan. Thank you. Lachlan.
I think it's really important to treat young people as equals, as a lot of my colleagues have pointed out. And I think it's also really important to have more meaningful conversations with young people, whether that is having a meaningful conversation with your patient in a consult and trying to understand their care needs better, or having more, whether that's an informal conversation that you're having with a young person, whether it's, in the pediatric ward, passing through the corridor, whatever the circumstance is of that informal meeting. Listening to young people and engaging with them in any capacity that you can, all the way up to those more formal structures, like having committees and having these panel discussions, having more of these. I think those insights from young people and from patients of all ages can kind of take form in so many different ways, and you really have to be open to having those conversations. And I think that is, it will really benefit clinicians, it will benefit the health system, because we have experience just as you do, and we have insights just as you do. And I think it can really, it can complement the care that you provide, and maybe even make your job easier as a clinician, or, as a system.
Thank you so much, Lachlan. And the last person in our elevator doing his pitch is Henry.
Okay, I think that we all know deep down that a young person aged 12, a young person aged 15, a young person aged 18, and a young person aged 25 all need different things in life, and they need different things from their healthcare. And as clinicians, when we take the time to actually consider that, that's what meeting the young person where they are really means. And when we meet a young person where they are, we can take them with us on their health journey that they're going to need, and we do that together. That's what developmentally appropriate healthcare is.
Brilliant. Thank you so much, Henry. And this brings our event to a close. And I'm just so grateful for everybody that's joined us online. A huge thank you to all of our panelists, and a huge thank you to Ari, our tech support, and Brianna and Chelsea for really genuinely doing co-design and leading us. Tanya.
Thank you, Anya. I, on behalf of the panel, really want to thank you for your facilitation. as a young person as well. Wonderful, professional, and you provided some insights along the way as well. So thank you so much.
Thank you so much, Tanya. I've taken us 5 minutes over, but I'll just do my little spiel. I just wanted to really wrap up that I think the most beautiful thing that we've heard tonight is that we haven't really heard anything once. We've heard it multiple times. We've actually got that shared vision already, that shared vision that can be had at the bedside, the shared vision that can be had at the boardroom. We've learned that we need to share our power, that we need to treat young people, as equals with respect, acknowledging that nothing should be done about us without us, and really trying to amplify those diverse lived experience voices, providing us with the holistic support we need to thrive and meeting the young person where they are. Thank you, Henry. I'm going to take that one forward. So again, thank you to everyone. We'll collate all of those additional questions that have come in, and we'll put together responses, and we'll definitely develop a position paper so we can continue amplifying that youth voice. So thank you, everyone. Have a wonderful night.